Thank you so much for inviting me to come today and share a little bit about the disease and how we're working to make it better for the people who are afflicted, the people who are caregivers, and for research. Our vision is a world without Alzheimer's. And our mission is to eliminate Alzheimer's disease through the advancement of research, to provide support and enhanced care for all affected, and to reduce the risk of dementia through the promotion of brain health. Here in Seattle at our chapter, we serve the two second and third components of the mission. Our research, the Alzheimer's Association in corporate offices the national offices are in Chicago, and they are the biggest private provider of research funding for Alzheimer's research. This is a question that often, is severe memory loss a part of normal aging? And a lot of people think that it is, and in fact, that isn't so true. This is a PET scan of a normal 20-year-old brain. Here's an 80-year-old, a normal, healthy 80-year-old person brain. Pretty similar. And this is a PET scan of an Alzheimer's diseased brain. This isn't a normal part of aging. At 65, 1 in 8 of us will have the disease. At 85, 1 in 2 of us will have it. And as we get older and we stay healthy, most of us will live to 85. So there are several different dementias, irreversible dementias. Alzheimer's disease is the most common, but there's also vascular dementia, Lewy body dementia, frontal lobe, Huntington's, multiple sclerosis, Parkinson's. There isn't really one single cause for Alzheimer's disease. Your age, as I mentioned, is a big factor. The environment and your genetics. There is a small percentage of the population that has a gene that is hereditary, and should that gene be in your genetics, your entire family is susceptible to the disease. So in the United States, every 68 seconds, there's someone that's diagnosed with the disease. Right now, there's 5.4 million Americans, and in Washington State, 150,000 that have been diagnosed. However, there are so many more that are living undiagnosed with this disease, and the disease often starts many years before a person is diagnosed. So it could be 15 years that the disease begins its journey, and the diagnosis is often much later. And part of it is the stigma of the disease itself, and those that are affected by the disease will often find coping mechanisms because they are beginning to see some kind of change in themselves, but they're trying to cover it up. And part of our research is really to get more into the early detection of this disease, because as soon as the sooner that we can detect it in an individual, the more we can work to help it or slow its progress. So these are the sobering facts. Alzheimer's disease is the 6th leading cause of death in the United States. And as I mentioned, 1 in 8 of us at age 65 will be affected, and over 50% of people over the age of 85. On that list of top 10 mortality rates, Alzheimer's disease is the only one without a cure. There is no survivors to Alzheimer's disease. And as Gail mentioned, younger onset Alzheimer's is now affecting people. Young onset is identified as anyone who is diagnosed before the age of 65. And part of it, as I mentioned, is that they're often misdiagnosed beginning. So there's about 200,000 to 500,000 Americans that are dealing with early onset. They're often misdiagnosed. There's a lot of financial impact. Most of these folks are still parents of young children at times. And the lack of appropriate services and supports for them is significant. And Terry and Kevin here are good friends of mine, and Terry is 56 years old. She has 2 sons in their mid-20s, and she was diagnosed 4 years ago. So we're living with her and her disease, and it's quite devastating. So 70% of individuals with Alzheimer's disease live at home, which means they require caregivers in the home. And approximately 80% of caregivers are family members. So here's a caregiver demographics. 2/3 of all family caregivers also work. So they're working during the day, and as, for example, my friends Kevin and Terry, Kevin luckily is an artist, and he had a studio in downtown Seattle. He now moved his studio into his garage, and he lives with Terry and tries to work at the same time. Most of the caregivers are female, married, no children in the home, and some with college education. And 40% of those caregivers are male. An estimated 15 million Alzheimer's caregivers in the US, and 350,000 of them are in Washington state. There's a lot of impact on the caregiver. It's almost as if they're they're working a full-time job, and then they're also working probably another half-time, part-time, 20 hours a week, just being a caregiver for their family member. And it is a very emotionally draining job and a physically demanding job. And it's so much more time-intensive care than some other diseases. So even when there is a spouse in the home, the child often remains the primary caregiver. And as I mentioned, they have to provide another 22 hours of care per week. And there is a great financial stress for the family on this disease. We have a family out in Yakima who her husband was diagnosed at age 44. He's now 50. He was the primary caregiver or provider for the family, and he's now in a facility. They had to sell their home. She had her own business that she had to close, and now they're trying to make ends meet with their 3 young children. So this, as many of you are probably business owners, and the effect of this disease on business is quite significant, and people don't often think about that. But the caregivers often have to quit their jobs. They pass up a promotion, and they have to decrease hours at work. And others experience increased absenteeism, lower productivity, and layoffs. And I was just speaking with Dr. Chris Rhodes from Virginia Mason, and he brought up a term called presenteeism, which means you're at work and you're a caregiver, but you can't spend all of your time being focused on your actual work. You're so immersed in your caregiving. So there are lots of services that we provide here in Seattle, and we actually serve 23 counties throughout the state. So we're from up in Bellingham down to Vancouver, the Kitsap Peninsula, all the way over to Easton, Wenatchee. So we have a big geographic area to cover, but we have several services that we provide. So there is a 24-hour, 24/7 hotline that anyone can call at any time when they have concerns, they need support, they just need to hear it, have somebody listen to them and provide some advice for them. The support groups are a great resource for both those affected by the disease and those who are the caregivers. So we provide support groups all over the state, and these are monthly meetings where we get together with a facilitator who's experienced with the disease, and it really is just a way to find some camaraderie, get some advice, just find a little bit of support in this very emotionally draining process of being a caregiver. Early stage memory loss programs are really starting to take off, and we're actually we do several walks through. We have a zoo program, we have a hiking program for those that have been affected with early stage memory loss. So we've also connected those who have been diagnosed with those who have just recently been diagnosed, and that has become an amazing program to really help folks kind of learn about what their journey will be through this disease. Connections Care Consultations is a program where we actually go into a caregiver and a family's home and help them to kind of make arrangements financially, make financial arrangements, help them with that process, but also take care of what the home looks like and what their future looks like. The education is training, conferences, and forums, so we're actually hosting our regional conference at the Seattle Convention Center on April 5th, and we have between 700 and 900 attendees, both professional caregivers, primary caregivers, family caregivers, doctors, and others that are working in the field. And this is just a day of truly learning about other ways to manage this disease. The Medic Alert Safe Return is a program where often those diagnosed with the disease will have a wandering, they often wander away, and this is an opportunity for folks who have been lost. It's a national program that helps us relocate folks. And the advocacy and public policy is another big part of our mission here in Seattle, to work in Olympia and get an Alzheimer's state plan passed. And as I said, we're the largest private funder of Alzheimer's research. So does anyone have any questions for me or any feedback? Yes.
We had an experience of a misdiagnosis of a family member. And so please be aware, this was through a GP, so go to a physician that deals in dementia and use the services of this organization, because that misdiagnosis and the medication given speeded up the onset of the dementia.
And absolutely, we are actually doing a big physicians outreach to educate general practitioners who really do not have those 10 warning signs even that are available for them to really understand and start to diagnose it early. Yes?
Can you talk about those 10 warning signs?
Yes, actually, I brought them with me, and I have a brochure, so I can hand those out to you. I'll run down to my car and bring those brochures back and hand them out. Yes?
What are the primary traits of Alzheimer's that distinguish it from other forms of dementia?
Specifically to Alzheimer's?
Yes.
Well, the memory loss is certainly one of the big identifiers. And that memory that starts at short-term memory loss, and it kind of decreases that way. So often it is kind of a confusion, and there aren't as many behaviors with Alzheimer's disease as there are with some of the other dementias. Did you have a question? Well, we're just starting to work on that, so I can get back to you on exactly what that looks like. But it's really to, plan for the future and understand that this is going to be an epidemic in this state in terms of financial resources that we need to put together for that. So we're really working on a state plan that identifies funding to help with research and support. Yes?
What were the environmental influences on the street?
Oh, I'm sorry. Yeah. I'm sorry, I'm kind of new at this, but I can get back to you on that environmental factors. Well, thank you very much for allowing me to come and chat with you. And if you have any questions, please come and see me, and we'll go get those 10 warning signs brochures from my phone.